Yes, a different hairstyle. I've grown. All right. So what I wanted to talk about today is really some questions that really can be summed up in the phrase, so what? To get it in. And I want to talk about the fact that one of the things that we're looking at when we're talking about providing services and working with children with developmental disabilities is how do we move from just our basic neuroscience to actually improving the outcomes for the children that we say we want to serve. So how do we move from these mice and rats on the left to actually making a change for that child who's on the right? Okay. So we know that there are several factors that are involved when you're looking at individuals who have neurodevelopmental disorders, such as autism spectrum disorders, Fragile X syndrome, Down syndrome. So it could be something involved with physiological markers. So some of you may be familiar for an individual who has Down syndrome. They have a significant ear shape, the spacing of the eyes. It could be environmental factors that we know lead to developmental delays, such as lead poisoning in the environment. It could be something happening at the neural level in terms of cellular activity happening. It also could be behavioral cognitive markers, things that we actually observe and see that would help us figure out whether or not an individual, in my case, looking at children, have a developmental disorder. And then we get to genetics. How do we study genetics? Because for some of these factors, such as the environmental factors or behavioral cognitive markers, we may be able to manipulate some things. But how do we look at genetics? And what role does genetics actually play in the development for these individuals? So obviously there's some limitations to doing studies with humans. We can't do things with humans that we have to, in terms of creating disorders. So how do we work around that? Well, a number of researchers have used animals. So how many of you have heard about chimpanzees learning sign language? Most of the room going in. And we know that honeybees do a dance to communicate when they get back to the hive to share information about where they found the most magnificent flower. Songbirds are known for mating for life, but what we've also learned about language development in songbirds is that they actually have two neural circuits. They have one for infancy and when they're developing. They actually go through stages of babbling, similar to what we think about when we talk about infant development. And then they have another adult neurocircuit when they're actually trying to grow into adolescence and they want to find a mate to get it in. How many of you have had guinea pigs? A couple. Be nice to your guinea pigs. They could be talking about you. We know that guinea pigs actually have a wide array of communication skills. They have ultrasonic vocalizations, they have different whistles, they have grunts, and they also have different sound system whistles and grunts for different situations going in. But what I want to talk to you about focusing on are how are we using animal research to further what we know about developmental disabilities. So I mentioned earlier that with genetics, there are just things we can't do with humans, but with IRB approval, there are things that we can do with mice, rats, and other creatures. So what researchers have done is that we have created what we call knockout mice. We create mice that have the genetic mutations, the physiological differences that we suspect play a role in autism spectrum disorder and other developmental disorders. So why rats? Well, rats have, in terms of science, they have larger brain cells and brain cells, so it makes it a little bit easier to do the mapping. Rats are actually a very social creature. Have you ever heard the saying, if you see one rat, there's probably another one around? Rats engage in social play with each other. They live in social groups, and they actually learn very quickly. And so it makes them a really good example of an animal model to use. So what have we seen in these knockout mice and rats that we've used to model for autism spectrum disorders? We've seen that mice who had been genetically manipulated demonstrate inflexibility. They demonstrate repetitive behaviors. So repetitive behavior in a rat or a mice may look like continuous grooming, continuous licking. They show little interest in other mice and rats. A typically developing rat or mouse would actually, when they see another one that they don't know, they go up to it, they touch it, they smell it, and you don't see that in the knockout mice and rats. We also see that for prenatal maternal infections, that these mice have fewer vocalizations, they play less, and again, they demonstrate that restrictive and repetitive behavior. So then it becomes the so what? So how do we take that basic science and translate it into making a difference in the outcomes of the children that we want to serve? So for example, we've created knockout versions of fruit flies to model Fragile X syndrome. And what we've seen is that when we can manipulate the genetic mutation, we've actually seen an increase in the cognitive behavior and functioning of these animals. So what does that mean for us? Does it mean that we will actually be able to have some physiological genetic markers that help us design treatment? Would it make us better and more efficient in how we measure the effectiveness of our treatment? Could we determine predictors and prognostic factors? Many of us may be familiar with the concept of early intervention, providing services when children are 2 and 3 years of age. What if we can identify earlier than that and start to provide intervention even at an earlier stage? What impact would that have on development? And would it help us develop some truly objective criteria for diagnosing someone with a neurodevelopmental disorder, combining the behavioral aspects with also the neurological aspects? So that is the so what.
I think we all learned a lot from Dr. Keller-Bell's presentation there. I learned that I'm going to go home and move my guinea pigs to a new room in my house because they're judging me. Questions for Dr. Keller-Bell and the work that she's doing around early language intervention. Questions, questions, questions. Okay, over here. The side of my vision here, the side that doesn't work. All right, heads up, coming in.
So on a knockout mouse that might be simulating autism or something like that, do you see any changes in how the male mice sing?
In terms of the vocalizations?
Yeah, because I've heard that the male mice actually sing ultrasonically to females to, you know.
There is some research. I don't know of a specific study that said that it changes how they sing, but there definitely are studies that show that mice have different vocalizations, and in some cases it's actually been described as having a different dialect, so that different mice, different strains actually have different vocalizations that vary in pitch and intensity.
All right, next question back here near the middle, coming in. Oh, well, 2 injuries tonight, all right.
I heard if you know one autistic child, you only know that child because every autistic child is different. So how do you model that using your mice knockout model?
Let me get it in. Well, I think that's definitely true. The reason that we call autism a spectrum disorder is because there is a wide range in terms of capability, in terms of cognitive ability, language ability, and their social and pragmatic differences. I don't think that when the studies for using rats as a model is to say that this is going to represent every child who has autism spectrum disorder. I think it is a way of addressing some of those questions that are really hard to tackle in humans, like what are some of the potential causes of autism? And I think it's more from that perspective.
All right, last question right here, coming in. Great catch.
Hello. You mentioned you guys, there's scientists are working on detecting it earlier in toddlers children, how early can you start to detect, and are there researches in, in mice to do this earlier in their early stages? Like how, I know I've heard it's around 2 years old or 18 months, but can you do it earlier in infancy?
To get it in. Well, most of the assessment measures that we have now, we have assessment measures in place that can reliably indicate whether or not a child's at great risk for developing autism spectrum disorders around age 2. However, most children are not actually given the diagnosis of autism until they're about age 3 or 4. Going in. And that's for a number of reasons. Sometimes people aren't sure. Sometimes people are hesitant to give a child a label that early on. Most of the research that's been done with animals is that you're seeing them through the developmental stages, but they haven't really seen anything at a specific pinpoint age in the rat and mouse models.
All right, ladies and gentlemen, give it up for Dr. Yolanda Keller-Bell.